All right, so first you have to introduce yourself.
All right.
So what is your name?
Recording?
I'm ready, yeah.
Okay. Hi, I'm Lara and my business is called Four Seasons Acupuncture and Healing Arts. It's not just acupuncture because I also do herbs, nutrition, massage, Reiki, cupping, gua sha, microneedling if you want to forego the Botox but you still want to get rid of them wrinkles, or you want to help with hair stimulation or acne, scar therapy, and then cupping and gua sha. So I do all kinds of stuff. You had another question.
And how long have you been doing it?
I've been doing this for 10 years.
Okay.
Yeah.
And then obviously you work on anyone, right?
I do.
Male, females, big, small
Non-binary.
people. Yeah.
Uh-huh.
Okay. And then you're here because you're at a mixer with the LCC. So
I am.
are you also a member of the community?
I'm a bisexual.
Okay.
I know. Biphobia.
That's okay. No worries.
I like to sit on fences.
And you're that's a good one.
It's nice
That's
there.
a good one.
It's nice there.
And so you're new around here, right? You're new in the Long Beach area? Or?
I moved here in July.
From where?
From Vermont.
Okay.
Yeah.
All
But
right.
I lived in California for like 17 years before that. I went to the Acupuncture and Integrative Medicine College up in Berkeley.
Okay.
That's where I studied.
And so I told you about that I have knee issues. I have bone on my left knee.
Yeah.
And on my right knee, it started off as a torn meniscus. And now it's basically turned into arthritis.
Yeah, that's brutal.
But it's not bone on bone.
Yeah.
And I have done acupuncture before.
Yeah.
So I didn't really see the benefit, but I'm definitely willing to try again.
Yeah, so why don't I tell you how acupuncture works?
Okay.
Basically, you have natural electricity in your body. It's your nervous system. So acupuncture is the medicine of the nervous system. And this is where Western medicine fails. Even though Western medicine says the brain is the main part of the central nervous system and the brain controls the body, they don't have a way to treat the brain or the body effectively.
Okay.
So there's that. So what acupuncture actually does, the acupuncture points are where itty bitty amounts of gases accumulate. It's the chemical aspect of your nervous system. So you've got minute amounts of oxygen, hydrogen, carbon that are pulling up in specific combinations. And when we insert a needle there is a chemical reaction that happens with the metal and those gases. And they start to fire things throughout the nervous system, basically rewiring the natural electricity of your body to say, this is how you feel now. This is how you feel now.
Okay.
So it's reducing inflammation, right? Inflammation is a big buzzword in the health circuits these days. Acupuncture reduces inflammation, increases circulation. So when you have a torn meniscus or a tendon, they don't have their own blood supply. So getting needles in there actually is pulling blood to the area. But 80% of Chinese medicine is actually the herbal medicine.
Okay.
So I have a really great formula that I have patients who are bone on bone.
Okay.
And Western medicine loves a permanent diagnosis.
Yeah.
That's not how anything works. Just
So you also mentioned cupping.
Yeah.
So what is that?
So cupping is it's a cup that you put it on the body and it has suction.
Right.
There's fire cupping and there's also like a handheld pump. He's filming me right now. So I use a handheld pump.
Yes.
And it basically pulls on the area.
Yes.
The way it works is that it's pulling dead blood out of circulation so that fresh blood can come in. And so once it's up and out, then your job is to drink a ton of water to flush it out of your system.
Cool. And you mentioned in terms of insurance, it sounds like you take. I'm on Medicare, so you say you take Medicare.
I take Medicare and Medi-Cal Kaiser. So basically, I'm in network with an organization. We all know health insurance is a big racket. One of the rackets is called American Specialty Health. They're an umbrella organization that handle almost all of the insurance companies of California.
Okay.
So instead of me having to be in network with everyone, I'm just in network with them, and that handles Medicare and Medi-Cal.
And so, again, I'm on Medicare. So if I go see you, does Medicare cover the full cost? I think they only cover a certain amount of sessions. Isn't that right?
It depends. Everyone has a different plan. I'm not going to lie; they don't pay me very well.
Yeah.
But
Well, I know
charge
that.
you about,
I know that.
I have certain add-ons, like cupping is an add-on, but I also work with people. I figure out, like, a lot of my patients who are on the lower end of the insurance, they'll come in twice a week. Once a week, maybe we'll do ear seeds, or we'll just do a cupping session, and then the next session we'll do needles.
Okay.
So I kind
Cool.
of work with people like that.
Well, thank you. I'm going to cut it short. I like this. Thank you for allowing me to do this. And I'm going to call you.
Okay, great.
I am going to call you.
Thank you. I'm so
willing.
excited.
Well, one more question though.
Yes.
So someone like me who's got knee issues,
Yes.
what would be the duration of time that I would come to you?
That's a really good question. I once had a professor who said, for every year that you have had this problem, give me 1 month to address it.
Okay.
I don't know if it's not really like that. Everyone's different, you know. I have patients who come to me and I'm basically a pain med. You know, they feel better for a few days and then they come back. You know, the pain comes back. Usually it goes down a little bit. Am I going to, I have a patient who has scoliosis. I can't reshape her spine. Another patient has one leg shorter than the other. I can't make them balance out. So I'm just pain management.
Right.
Sometimes I'm just pain management.
Okay.
But I also shrank some tumors in the last month, you know? So,
All right. Sounds good. Thank you for
right.
letting me do this. I appreciate it.
Yep.